we are going to talk about a lot of management methods, various drugs that are being used, and various hospitals and outpatient um, facilities like clinics that have been using various regimes and how they are treating. So, at the end of the discussion today, I would like you to take away that a patient who is visiting you, what should be their what should be your approach to treating them? Number one. Number two, another important thing I want to do is I want to discuss the prophylaxis for especially for the healthcare workers. It hurts me to see that in many countries, including our US, healthcare workers are exposed unnecessarily to a higher dose of the virus without proper protections. So I wanted to make sure that we talk about what prophylaxis they can do. So today's lecture is sort of a, hello Alexandros, how are you? So today's lecture is going to be a sort of a wrap up of all the various drugs we have talked about and all the immune mechanisms that we have discussed. And then we are going to look at the prescriptions that various doctors have been using and what is the benefit of them. And I'm going to add some parts of my own opinion as well for what could be added or subtracted from those prescriptions. So get ready for today to understand how to manage the outpatient patients in the outpatient. Now, for those who are watching as laymen or non-medicos, these are not prescriptions for you. The drugs in here can be lethal, they can be fatal, they can be bad. So especially they can cause heart attacks or they can cause blindness. So this is not a prescription. So please don't take this as a prescription. Talk with your doctor. This is mostly for the healthcare professionals who can then understand how to manage their patients, and they would then manage and design your therapy case by case. So you're all welcome to watch what are the mechanisms for various drugs, but do not use this as a prescription. Hello, guys. So I'm very excited for today's discussion because I'm going to actually take care of hydroxychloroquine, zinc, quercetin, vitamin C, vitamin D, azithromycin, and I'm going to talk about how we can combine them into a regime that we can use to help our patients not go from moderate to serious situation. So the objective of the discussion today is the following. We would like to look at a prescription regime that would allow our patients to avoid ending up in the hospital. So in that, I have a bunch of case studies as well that I would put in front of you. Many of these studies are actually anecdotal doctors' experiences. These are not studies with the control arm and the other arm and double blind and the number of patients present. This is mostly doctors providing their experiences, and I'm going to use them to provide a possibility for management. So let's start our discussion. So thank you guys, everyone, to be here. Yes, absolutely, Tammy. We need a very aggressive outpatient approach, and that is what I'm going to do. I'm going to offer that how we can have an aggressive, thank you very much, outpatient approach, so we can actually prevent the patients from ending up in the hospitals and also reduce the load on the hospital and also reduce the exposure of our healthcare workers in the hospital. And I think this is interesting that if we take this regime that I'm talking about, I think that we can start getting out of the lockdown earlier. It's a cheap solution, inexpensive solution, and we can start lifting the lockdowns and we can start moving towards the herd immunity. The basic objective of this discussion is going to be this. So let me explain. This is a very important point. Here is the deal. When 60 to 70% of our people have become infected in a community, then the herd immunity develops. However, for SARS-CoV-2 to reach that level, it may cause a lots of human life damage plus lots of resource damage on the healthcare system. So if we can have drugs that can slow down the replication of the virus so that our immune system has enough time to overcome the virus and become immune, or become trained, then we can actually move towards herd immunity with this cheap and inexpensive solution. So that is the point. We'll save lives, we'll save medical resources, we'll save healthcare workers, and we will be able to start our financial cycles again very soon. So I believe in those things. So let me actually show you what these medicines are and how to use them. Thank you, Mike. So today is a very important topic. We are going to kind of wrap up everything into a management approach. I'm going to share my screen and we'll start. And by the way, everything I'll discuss here has some sort of a data backup or a study backup or a doctor's experience backup. So I'm not just doing this by just myself, and I would love to kind of show you what these backups are. Yeah, so Tony, UK's herd test, of course, imagine this, that they were going to do the herd immunity without any immune system help or any help to the body to avoid the virus or slow down the virus, and they were going to cause a lot of damage. So I'm happy that they went to isolation instead of just doing what they were going to do. So let's start. So here you're seeing, first of all, realize that the stages of the disease are mild. So I should put asymptomatic here as well. Asymptomatic. Then mild. Mild is where one has cough or fever or GIT symptom, or maybe anosmia, meaning loss of sense of smell and taste. So mild symptoms, which are just bothersome, but they are not really going to be so, the shortness of breath is not there. Let's just say that. So that is one. From mild, we proceed to serious if the virus is rapidly growing and our immune system is not able to handle it. And in the serious, I would say shortness of breath. Of course, in the hospital protocols, there are more tests and then there are more things. I've discussed those in detail before, so I'm not going there. Serious is the second one where patient may need oxygenation. Then is a critical where patient may need ventilation. And hopefully patient can keep exiting from these stages. And if they do not, then the death occurs. What we are talking about are the cases that are asymptomatic, or the cases that are in mild stage, or some cases that may become serious and we can kind of pull them back before they become properly serious and critical. Second thing is, what we will do today is that for you guys who are healthcare professionals, how do you do the outpatient prophylaxis? How do you save yourself? And in that, there is at least one country, India, that has come out strongly to say, here is our recommendation for prophylaxis, while others have not done that much. So with this, I want to show you at least first a video. So here is a video of a person. So you can look at this, how I beat COVID-19. He is an audioholic. So he is actually an audio channel person who became COVID-19 ill, and he stayed ill. Let me actually show you his face as well. Here is this person. He stayed ill for about a month. And he was asymptomatic, but he was positive. And for 1 month, there was no support other than he being isolated. Finally, so now 1 month, he's sort of mildly bothered by the symptoms, mostly asymptomatic, COVID-19 positive, disease is not going anywhere. He has the virus, it is not leaving him. So he's positive, he's not going out, he's trapped in his room. And finally, the doctor gave him hydroxychloroquine with azithromycin 5 days, and he cleared. So this is your first proof here, at least for one person. Again, it's not a study. It may not work on me, it may not work on somebody else. But at least there is a person who's saying that, hey, I did it. And I'll show you more studies as we discuss today. So let's go back to our discussion. And what I'll do is that, because many of the details I have already done in previous lectures for how vitamin C works, or how vitamin D works, or how hydroxychloroquine works, I will link them in the description, or if it is YouTube, I'll link that as I go along. So you can actually, if you wanted to nerd out and go and see what is the deeper mechanisms, you can go and see them there. Absolutely, Alexandros, I totally agree with you. So Alexandros says, anosmia and low taste could be a result of the zinc deficiency. It is possible, yes. So thank you very much, Rebecca, and let's start. First of all, I want to start from here that, of course, social distancing is the only known way at this time for preventing this disease. Once we have vaccination, that is when we will become really free, or once we have developed herd immunity, that is when we will be really free. And you know that in Germany, they have started giving certificates to people who are immune or have gotten the antibodies, so these people can go out and start working. But we need to reach this point. And I think with the regime that you would see today, we can actually reach towards herd immunity with no damage, almost no damage, and quickly. So social distancing is one. Then, in my opinion, surgical masks is a very, very important thing for all of us to use. And I have done a video in detail about what is the use of the surgical masks. Then I've also done a video about the homemade masks, which may be able to reach 80% of the efficiency of a surgical mask. So these videos, I'll link them separately. I'm not going to redo them. So social distancing and surgical masks. Then I'm going to go to the treatment regimes. First of all, I'm going to talk about, once again, hydroxychloroquine. You know that I have probably, my video is the only video on the web which actually discusses the basic mechanisms of how hydroxychloroquine helps us combat this virus. Everybody keeps saying that there is a mechanism that itself helps reduce the replication, but they do not go in the thorough details of it. I have done a video where I go into the mechanisms. Here are the basic mechanisms. Number one, hydroxychloroquine is a zinc ionophore. We know that. Number two, hydroxychloroquine causes our ACE2 receptors. These are the receptors which are used by the virus to connect with them. So let's say this is the virus S protein and this is ACE2 receptor. I've been talking about it every day. This binding, this hydroxychloroquine causes change in the ACE2 receptor, enough change that this binding capability is reduced. And again, the point of all of this is going to be that we would slow down the virus enough that the disease cannot proceed fast enough, and our immune system gets a chance to combat the disease or develop the immunity. So James says that, can you quickly explain exactly how herd immunity develops step by step? How is someone able to get immunity? So I will discuss that. James, how about we do that tomorrow so that I can keep this lecture kind of focused on the management? I'll do a separate talk about the herd immunity. Is that, would that work? So back here, so hydroxychloroquine causes the ACE2 receptor, one mechanism. It makes it enough changed that the binding affinity reduces. And the binding affinity, if I tell you that the more detail over here, the last amino acid cannot get glycated when the hydroxychloroquine is present. I've done that discussion in my video. So this is one mechanism. The virus will not be able to enter that successfully, and the replication and the virus entry would reduce and stall. So that's one way. So see, we are slowing it down. Then virus entry in the cell. Remember that we talked about it, that the interior of the cell in the presence of hydroxychloroquine will become basic, a little more basic, or less acidic. And that reduced acidity makes the cell membrane a little less permeable to the virus to go in. So virus entry into the cell is reduced. That is another way to reduce the replication or the speed of growth of the virus in our body. Then virus entry in the endosome. So within the cell, then virus would like to enter inside the various organelle and kind of use them. And that hydroxychloroquine, again, the basic point is that because the interior of the cell is less acidic, even this function becomes impacted. So viral replication reduces. And then virus replication enzymes. So if you see here, the enzymes that virus is going to use, those enzymes will not function correctly. So remember, in the presence of more basic environment or less acidic environment, the enzymes do not work correctly, which and the virus was going to use, so the virus replication reduces. So keep this in mind again and again, and that is the benefit of these drugs is not to kill the virus altogether, but to slow down the virus enough that our body gets a chance to develop immunity and kill the virus before the virus kills us. That is the basic fight that is happening here. Good. Now, I'm going to go back here. So hydroxychloroquine is an important drug here. And I would not recommend chloroquine because that is more dangerous than hydroxychloroquine. Hydroxychloroquine in therapeutic doses is pretty safe drug. And now let me add this as well. And this, I have been getting this question a lot, that is it safe in pregnant women? So yes, hydroxychloroquine in therapeutic doses is also safe in pregnant women. Hydroxychloroquine is actually allowed to be used in pregnant women, and it is also allowed to be used in lactating women as long as the baby's weight is greater than 5 kilograms, so that they can actually use that too. And for that, let me very quickly show you so here is CDC site, hydroxychloroquine and chloroquine, and they have given, so if you see here, this is the emergency use authorization by FDA to use hydroxychloroquine as a trial medicine. So this is allowed. This is on the CDC site as well. It is not really approved, but for clinical trials or on a trial basis, it can be used. So we are back here. I have done this discussion in detail for how it helps. I just want to make sure that you are aware of the usage now as a prescription. So hydroxychloroquine collects in the tissues. Guess which tissues? Lungs. We want it to be there because we want the virus to be prevented there. Liver, spleen, and very importantly, kidney. We know that in the acute cases, in the serious and critical cases, kidney failure starts. You know that in addition to the ventilators, the only other important thing that the doctors are finding that they need are the dialysis machines, because kidney failure starts as well. And imagine if the hydroxychloroquine is sitting in the kidney, it is going to try to prevent the virus over there as well. In addition to that, to some extent, it also accumulates in brain and spinal cord. So this is where it accumulates. Then hydroxychloroquine has a half-life of about 40 days. So if I take a dose today, it is going to have a half-life of about 40 days. So it stays in our system for a long time, which allows it to sit in there and help combat the virus on a longer term basis. Now, going towards the management, usage of this. So usage of this is from India, and I'm going to show you the paper or the approval from India. This is the Indian advisory on hydroxychloroquine as prophylaxis. And if you see here, this is their dosage recommendation, which is really, really interesting. So here is a dose. First, Who are they giving it to? Number one, asymptomatic healthcare workers involved in the care of suspected confirmed cases. This is very important, guys. If you are helping COVID-19 patients, you have to make sure that you are on prophylaxis. This is my opinion. Again, this is not my prescription to you. I'll keep saying it. This is my opinion. If I have my patient, I would give them. The second thing is those family members of the confirmed cases who are taking care of the patients, they are giving the prophylaxis to them. And now what is the prophylaxis? If you see here, their prophylaxis is week 1 for healthcare workers. First week, they are giving 400 milligram twice. That is an 800 milligram of the loading dose on the first week. Then for the next 7 weeks, 400 milligram once a week. That means 200 milligram in the morning and 200 milligram in the evening, only once, one day in a week, and keep doing that for 7 weeks. So that is a prophylaxis that they are asking for healthcare workers. For the family members that are taking care of the patients, first week, same loading dose, 400 milligram twice on the first day. So 400 maybe in the morning, 400 in the evening with meals. And then for next 3 weeks, instead of 7 weeks, next 3 weeks, 400 milligram once a week. That means 200 milligram in the morning and 200 milligram in the evening. And that is the prophylactic medication. They do have some contraindications. For example, patients or people younger than 15 years of age, they're saying don't give them prophylaxis. People who are contraindicated for allergies or known to have allergies to these drugs or quinolines, they are not to be taken, or people who have underlying health disease comorbidities. But I can tell you this, I have tested it on my patients. A couple of patients had the cardiac issues as well, and we have used hydroxychloroquine as a prophylaxis, and they're fine. There is one more contraindication that is important, and that is the people who are known to have retinopathies, because hydroxychloroquine can cause damage with to the eyes, at least in the long term. So people who are known to have retinopathies, don't give it to them. Now remember this once again, hydroxychloroquine in the short duration, in the therapeutic dose, is pretty safe. All the evidence that I'm hearing from doctors who are either on the YouTube or calling me and talking with me, they have not seen any issues so far when they are prescribing it. So good. So that is the prophylactic use of the hydroxychloroquine. I could not find any other place who is doing the prophylaxis. So kudos to India that they have actually offered it. I believe they are saving their healthcare workers by offering this prophylaxis to them. We all should do this. But again, I cannot prescribe to you. I cannot prescribe it to you, so I'm not a doctor. Don't take that as my advice. However, I think every healthcare worker should take hydroxychloroquine with zinc. So I'm going to go to that now. Any issue so far with this drug, hydroxychloroquine? We have done a detailed discussion for how these mechanisms work. And so that's a separate video. Going to the next drug, azithromycin. So there have been some evidence from the, just one second. Sorry. I was trying to turn off the text dings. Okay, so azithromycin. So there have been some, I shouldn't call them studies, but there have been some evidence that when hydroxychloroquine is used alone, it is less potent compared to when it is used with azithromycin. And there have been many speculations that maybe azithromycin is acting to help with the secondary infections. However, the study that came from French doctor, he said that it seems like it potentiates the effect of hydroxychloroquine. So even this person I showed you the video of, that how I combated the um, COVID-19, the person who was asymptomatic but had COVID-19 for 1 month and it was not clearing, he was given hydroxychloroquine with azithromycin, and that is how he recovered. So I would actually once again recommend that azithromycin. So you can say that azithromycin should be given to someone who has now developed symptoms maybe, or who has persistent virus and is asymptomatic, just like the person I showed you. So what is the dose here? And I have a person, Dr. Zelenko from New York. And again, guys, let's not be political about this. I have no leaning towards liberals or towards conservatives when it comes to medicine. I know that Dr. Zelenko has been picked up by the right-wing media, and they have been, Rudy Giuliani interviewed him, and he has been interviewed and presented a lot. But I'm just looking at what he has done. That is what matters to us, not what are the political associations. So azithromycin, Mount Sinai offers 500 milligram loading dose on the first day of a patient who is hospitalized. Then 250 milligram once daily for 4 days. This is Mount Sinai's protocol, and I can show you quickly that protocol over here somewhere. So this is the Mount Sinai's protocol, Mount Sinai Health System. And in here, you can see, if I zoom in a little bit, you can see that they give hydroxychloroquine and then they add azithromycin. Do you see here? This is azithromycin. So again, the situation is that the patient may have gone from mild. You have a patient and you feel that this patient may be progressing towards more severe cases. Start them on a azithromycin as well and give them azithromycin for a week. Of course, you are responsible to figure out if they can take azithromycin, allergies, their body situation and all of that. But azithromycin in combination with hydroxychloroquine for a week is an excellent outcome. Then zinc. And I have not done a direct discussion of zinc, except that the discussion I've done that is in the hydroxychloroquine discussion. What zinc does is that zinc reduces the virus replication in our cells. So if this is our cell and the virus is replicating, what zinc does is it kind of stalls the replication. And I discussed the mechanism there. So zinc itself is a beautiful product for us to work with the with the coronavirus. Problem is that the zinc cannot enter the cell because zinc is charged, and our lipid membranes do not allow charged particles to go in. And I discussed that in my other video. So here what happens is that hydroxychloroquine acts as a ionophore, or a channel for zinc to go in. This is what I just mentioned above, that hydroxychloroquine. So zinc alone may not be very useful. However, zinc with hydroxychloroquine is useful. And I want to talk about one more thing, because people have been sending me this discussion, this compound, and saying, hey, Dr. Mubin, please look this up, quercetin. So quercetin is a naturally occurring bioflavonoid. It is a pigment in fruits and vegetables. This is also a zinc ionophore, at least according to one study in 2014. I have not seen any more studies. So there is just one study that was done in 2014, which said that zinc possibly acts as an ionophore. And they also say that zinc possibly acts as an antioxidant. And I think that is the language that is used for all kinds of supplements and minerals, that people simply say that, hey, it is possibly going to do it. However, we know, at least in this case, that there is a study. So quercetin is over-the-counter medicine, or not medicine, I shouldn't call it medicine, compound. And it is present in apples. It is present in grapes, broccoli. These are my representation of these things. So broccoli looks like a tree to me. And berries and oranges and cherries and tea. I love tea, so tea can be great. So quercetin supplement 500 to 1000 milligram daily. I would love if the prescription structure in outpatient is composed of hydroxychloroquine, azithromycin course for 5 days and then stop, with zinc, with vitamin C, and with vitamin D. I feel that that would be a beautiful management regime. So going back here, we were talking about zinc. I hope that this is clear that zinc is useful. Now, Dr. Zelenko, let me talk a little bit about his studies. What he did was not, I keep saying studies, his observations. He said that he has treated now 699 patients in outpatient settings, that means his clinic. And whenever he suspected that they have COVID-19 or the symptoms of that, he gave them, so we don't know, maybe all of them were COVID-19, maybe none of them was. He is in New York, I would suspect a lot of them were. He gave them hydroxychloroquine with azithromycin with zinc. And he said that none of these patients proceeded towards becoming serious or going to hospital. And he said my parameter was they should not die, and none of them died. So that is his observation. So I'm using his dosage as well that he has been using. So zinc dose that he has been using is 220 milligram daily for 5 days. Yeah, so I'll talk about ivermectin later. But I wanted to make sure that over here we have a regime available to us, that we have an approach towards our patient, that we go in there, serve our patients with somewhat confidence that we can try to prevent them from becoming serious. That is the objective here. Again, please, these are not my prescriptions. These are my collection of evidence from people and collecting it together and sharing it with you. So don't please self-medicate yourself. Don't harm yourself. I'm saying it again and again because I don't want to become, I try to make sure that I can help people become better. It would be sad if somebody takes this and misuses it and becomes ill. Okay, then vitamin C. I have done a detailed discussion about the vitamin C. How vitamin C helps is, number one, it neutralizes the reactive oxygen species. Remember, we talked about it in our previous vitamin C discussion, that our body produces a lot of reactive oxygen species when it creates energy for ourselves, ATP. And secondly, when we are infected, which is important for us in coronavirus case, we are infected. When we are infected, our immune system needs ascorbic acid or vitamin C to be able to neutralize the reactive oxygen species that are produced in abundance. And we also know that it helps regulate the immune system. And so there is a study that I discussed in that video of a number of students, on which I think 460 or some students that did the study. And the conclusion was that absence of vitamin C dysregulates the immune system, and presence of vitamin C helps regulate the immune system to work correctly. So that is also a very, very important thing. So vitamin C, 2000 milligram daily, supplement, upper limit. So take good vitamin C, or if you are prescribing to your patients, give them vitamin C as well. This is not present in French study. This is also not present in Dr. Zelenko's medications. This is my opinion that vitamin C must be provided so that there is immune system balance going on while we are fighting with the virus. We have given hydroxychloroquine to reduce the virus replication and entry into the cells. We are giving zinc to reduce the virus replication. We are giving azithromycin to help this thing. And finally, I believe vitamin C needs to be there as a side hero to keep the immune system balanced. Then, moving on, vitamin D. Vitamin D is critical to keep to have for these patients and for healthy individuals. We all nowadays, especially in the lockdown, have less exposure to sunlight. Look, we need at least every day 10 to 15 minutes of sun exposure on arms, legs, back, and abdomen, so almost naked. We need to be lying down somewhere naked for 10 to 15 minutes to get enough vitamin D so that we can combat everything correctly. So if we are not doing it, we may not have the right vitamin D levels in our body. So vitamin D supplements, 1,000 to 2,000 international units. And again, I understand that giving the supplement is not sufficient because supplement is not active vitamin D. It still needs the sunlight. It still needs sunlight. So if you are a patient or you have a patient who you know is deficient in vitamin D, then you may have to give active vitamin D, which is by prescription only. Please do not take it by yourself. It is the most toxic vitamin, but if it is taken anywhere from 400 to 800 international units, depending upon the age and the other comorbidities. That is the vitamin D prescription. So this is where we stop our discussion of the basic drugs that would take part in it. How do I look at it now? The way, if I have a patient, if they are asymptomatic and positive, I would give them hydroxychloroquine and azithromycin. I'll give them zinc and I'll clear the virus out. If they are a healthcare worker or somebody who's exposed to COVID-19 positive and they're going to stay there like family members or healthcare workers going out, I will give them prophylactic hydroxychloroquine. I will actually add zinc to their regime as well. I would add vitamin C and vitamin D as well. These are not expensive materials. They are cheap materials, inexpensive, but they are very, very useful. And the hydroxychloroquine has a longer half-life, so it can stay in the body for a longer time to keep helping them. So prophylaxis. Then if I have outpatient patient who may have symptoms and I suspect they have COVID-19 or they have become positive for COVID-19 by testing, I would put them on hydroxychloroquine, azithromycin course for a week. I'll give them zinc for a week. I'll give them vitamin C and vitamin D. This is what I would do. The only question in my mind that I cannot answer yet is, can quercetin be added with hydroxychloroquine? Because hydroxychloroquine itself is an ionophore for zinc. Do we need to give one more ionophore for zinc? So if somebody cannot get hydroxychloroquine, they may be okay to take quercetin. I do not know their efficacies either. I do not know quercetin, how potent it is compared to hydroxychloroquine. So these are the thoughts that I do not have answers for. So if somebody has the answer, please put that in the comments or send me a note. But this is where we are. What do you think? Does this make sense? This is outpatient. The point is this. What is the objective? Objective is that our patient doesn't become ill enough to end up in serious situation and in hospital. Let us avoid them getting into the hospital, one. Secondly, now I can talk about the herd immunity. Look, if I am a patient or possible patient, I am taking hydroxychloroquine, vitamin C, vitamin D, zinc, maybe not azithromycin as prophylaxis, but I'm taking these drugs and I get the infection. It is possible that the infection would develop slowly. It would also depend upon my comorbidities. If I'm very ill for other reasons, I might still not make it. But if I am healthy and I take these, it is possible that I would develop immunity and I won't go to hospital. And now I will become a member of herd immunity. But if I do not do that, let's say I sit here in the lockdown, as I'm sitting for a month now, I'm sitting here in the lockdown, I'm not exposed to the infection. Don't you think that when I'll get out, I'll have a chance to get exposed? You cannot lock down the countries or communities to say now after the lockdown is lifted, nobody should ever visit them because they might bring the infection in, and still those people who do not have immunity, they can still infect them. The second wave would occur, or third wave would occur. So how do we help with that? Give hydroxychloroquine prophylaxis. Give them azithromycin if needed, but at least give them zinc, vitamin C, vitamin D, and or maybe quercetin. If you don't want to give them hydroxychloroquine, give them quercetin and zinc. So at least that stalls the virus replication and speed of damage, and hopefully gives us immunity. This is what my opinion is. Again, I'm going to stop here saying this is not a prescription for any single person. This is just what I think I've gleaned from all the discussions I've seen. So at the end, I'm going to show you a couple of more studies. So let me quickly. So this one, I have created a page on our website called Corona Information Center. And I'm collecting the links here. In addition to my videos that I've done on Corona, which are here, I am also collecting the links, for example, masks and related links, various treatment regimes that various hospitals are using, and I could get them. Then useful link towards WHO and others. So here, this is what I was showing you. This is one. Then I also want to show you this study for azithromycin. Sorry, not study. This is the azithromycin in pregnancy. Now, this is important. Azithromycin in pregnancy is category B drug. It is not approved for pregnancy. So don't give azithromycin to pregnant women unless it is really, really critically needed. So if you see here, US FDA pregnancy category B, animal reproduction studies have failed to demonstrate a risk of the fetus, and there are no adequate and well-controlled studies in pregnant women. Use is not recommended unless clearly needed. So don't give azithromycin to pregnant women. Here is the Rudy Giuliani talking with Dr. Zelenko about his regime. Again, please stay apolitical with me. You don't know if I'm liberal or I'm conservative, if I'm pro-Trump or not Trump, and it doesn't matter for medicine. So it is an interesting, that doctor has done an interesting experiment. I wanted you to see that. Then this is a site for zinc, that what is the zinc daily need and what is the zinc, what are the things in which zinc is present. Here is a site for vitamin C and the sources and daily needs. So as you know, I always come with the resources and the links. So this is vitamin D, their utility found in which foods and the links to that. This is how much sun do we need. So I mentioned 10 to 15 minutes of the whole body. Of course, use the sunblock and then be wise about it. This is the vitamin D, active vitamin D, which is a prescription only medicine, not a vitamin D supplement, active vitamin D, and what is the dosage needed in various situations. Here we have quercetin, where is it found and what are the various values that are needed. I'll put all of those links out in the description. So I hope this is good. Can we stop now and can I have an off tomorrow? So I have not been taking an off for now so many days. And my wife was asking me today that, hey, you should take at least 1 day's break. So if I take a break tomorrow and we come back day after, would that be okay? And please, guys, thank you very much. So we'll do the next lecture day after tomorrow. And I'm still continuing to request you to share these videos. If you don't believe in the video content, if you feel that it is not correctly researched, or it may not be the right material, then don't share it. But if you feel that it is good material, please share it. I would be thankful for that. That is how we can reach more and more people and take care of the fake news and take care of the rumors that we are seeing. And thank you very much, guys. I would see you all day after tomorrow. And we will talk about, I'll decide the topic and discuss it. If you have a comment about the topic, leave that here. So thank you very much. Love you all. Stay safe. If you're a healthcare worker, lots of respect for you. Please, please stay safe. Have PPEs. If not, do some prophylaxis. Don't risk yourself. Don't risk your patients. Don't risk your family members. And I hope that everybody stays safe. We use these drugs and come out of lockdowns quickly and resume our daily life. Thank you very much. Bye-bye.